Welcome to an hour of HealthMade Radio. HealthMade is a community for natural health seekers where we educate people about common health conditions and share extensive research on the most effective natural health treatments and promote legislation that protects our health freedoms. A core concept belief is in the innate intelligence and healing power of the body, and if properly supported spiritually, emotionally, and nutritionally, it can find its way back to health. HealthMade Radio will bring information from integrative health experts throughout the world. Check us out at healthmade.co. Health is what you make it. I'm Dr. Michael Karlfeldt, and I will be your host. Today's guest is Dr. Jill Crista. Is mold on your health radar? Dr. Jill wants to make sure it is. Mold can lurk without a trace or a scent. If this is happening where you spend time, you could be sick from mold and not even know it. Dr. Jill Crista is a naturopathic doctor and one of the leading experts in the treatment of mold-related illness, not only from her 20 years working with patients, but because toxic mold sprouted in her own home. That experience inspired her to write a book called Break the Mold. It clearly and simply outlines the tools that everyday people can use to conquer mold. Dr. Jill also trains doctors to become mold literate and supports mold canaries through her membership portal. Her motto, break the mold, take back your health. Dr. Crista, it's such a pleasure to have you on the show today, and this is something that really impacts people in a lot of ways, mold, and I'm really excited to have people like yourself to bring this information to the forefront. So thank you so much for coming on the show today.
Oh, thank you for having me.
So I'm curious. Your book, Break the Mold, it is a book. It seemed like I was reading it. It's a book to yourself 15 years ago. So here you went through this whole process where you're impacted by mold 15 years ago, and now you've done all this research, and this is what you wish that you would have known 15 years ago. So what are some of the things that you would have wanted to know 15 years ago that really stuck out when you did all this research?
Yeah, so it's to me as a clinician 15 years ago, because I was working with chronic Lyme patients who they were dealing with just, you do everything that makes sense in the books, and they weren't getting better. And I was trying to figure out, what's the block? Because it was just a minority of the patients that didn't get better. As we see in naturopathic medicine, functional medicine, when you find and address the cause or treat the cause, people tend to get better. And these people just weren't. They were doing everything right, the hardest working patients you'd ever know, and they just weren't getting the gains that the majority of the patients I was treating were getting. And in one of those patients, they found black mold. And that was my first exposure to how many different ways mold can affect the body that I wasn't really aware of. And then 15 years down the road, well, almost nearly 20, we had mold in our own home, and it duped me. Even after being a mold expert for that many years, it tricked me. And that's when I decided to write the book, because I thought, okay, once I figured out it was mold, once the flood revealed itself, then I could identify it. I was like, oh, this is mold. So then, we could get right into the action plan. And that's when I realized I kind of have a system here because of working with all those mold patients for that long. I could really, and it seems to be pretty systematic, and I should just write this down, because this is stuff that everybody can do. You don't have to have a doctor to get better from mold. It sure helps to have a mold literate doctor that's kind of helping you navigate it, so there's less suffering and faster recovery times. But the bulk of it are, natural medicine is a real champion with mold illness. So that's when I wrote the book. Yeah.
So, because is mold something? It seems like it's becoming more and more of an issue. Is it more kind of like a new illness that we're dealing with? Mold.
That's such a great question. I do get some flack, it's just trendy now, and I hope that my colleagues and I that specialize in mold have done a good job to make it trend, because it is not necessarily a new issue. However, it is on the rise because of a number of factors, chief being how we build our buildings. And the fact that, I know in Idaho, it can get pretty cold and there can be rainy seasons, and we've just we have an overconfidence about these building materials that you can just slap up a house in the middle of the rain and everything will dry out and it'll be fine because things are, in air quotes, treated. But yeah, we are really creating problems. And I loved your interview with Michael Schrantz, the mold environmental inspector. He made a great point that we also have the energy crisis forced everybody to close up their homes and make them airtight. And that's exactly what mold loves, is stagnant air and a controlled temperature and trapped humidity. And we use the mold's role on the planet, how we find it in nature, is to decompose previously living organic material. If you look at what we're putting on our walls, drywall is covered with a paper, which is one of mold's favorite foods, previously living organic material, and we've already pre-digested it a little for it. So we're kind of creating the problem.
So we're kind of helping it along a little bit, exactly, with how we're building, and we're thinking we're being environmentally friendly, because we're conserving energy. But what we're not recognizing is that we're not being human friendly. We need to make sure that we're creating a house that is healthy for us, not just energy efficient. And that's why bringing this type of information to the forefront is so crucial.
Mm-hmm. Yes, and we're also creating sort of fungal superbugs by adding antifungals to paint and to flooring and to treated lumber and to our crops, instead of growing in a regenerative style, doing this monocrop culture, and then we spray it with these antifungals, and then they become less effective using them as a medication. So we're really, we're kind of asking for it with our behavior.
Yeah, exactly. And it's interesting because people tend to be aware of the antibiotics and how that's creating these bacterial superbugs that are antibiotic resistant. But I don't think they really recognize that the same holds true in the fungal world, in the mold world, where we are then using these, and we're using that in feed for our animals and crops and things. So we're actually getting that into our food supply, and so we are ingesting that, and that is creating then these super fungus within us.
Mhm. Yep, that's what we see. And just from a prescriber standpoint, if you do need to use antifungals, it's been my experience that the undertreated fungal infection, let's say a yeast vaginitis or something like that, the idea is that you just give someone 1 or 3 days of an antifungal and that'll knock it back. And that is it's educating the bugs and making them more resistant. And in my experience, people have had much less resistant strains when we are persistent and consistent with that, if they do need the antifungal.
Yeah, so the key is then to, if it's being prescribed, then to be prescribed long enough. Like when you're dealing with things like Lyme or viral infections, you want to make sure that you do it long enough to get rid of it. Otherwise, like you're saying, you're just educating the bug, and whoever survived, they are just going to be smarter and be resistant.
Mm-hmm. And you can understand why conventional medicine, if all you have is pharmaceuticals in your toolbox, you can understand why they want to be very judicious with that. But we're blessed. We have herbs. They are just as hard on the bugs. Yeah, they're just as hard on the bugs and not as hard on the humans. Some of them are, but we can do them for a lot longer, safer.
Yeah, exactly. And what's fascinating with herbs, and I usually reiterate that, is that they have such a complex structure compared to the pharmaceutical medication, which makes it very hard for pathogens to adapt to them and then overcome them, because there's just so much intelligence within the structure of the herb, and the herb has evolved along with these different pathogens, so that way they've kind of adapted in a way, or they try to be a step ahead to make sure that they survive the pathogens that it's in its own environment.
Mhm. Yeah.
So,
yeah, we're so lucky to have that tool.
yeah, exactly. So what are some of the kind of general, what are some of the things that people should watch out for, to can identify that maybe mold is part of my disease picture? Maybe that's why I'm not feeling the way I should.
Yeah, that's so hard to answer because it's going to look different for everybody. That's the tricky thing about mold. And we should talk about how mold makes the body sick. So there are mold spores. Most of us are familiar with that. Even the CDC recognizes that mold spores can cause things like sinusitis, allergies, asthma. And then you can get spore infections for someone who's immunodeficient, such as a cancer patient or HIV, where you can get aspergillosis infection of the lungs. And that's kind of where the definition of mold illness stops. And my role, I feel like, is to educate people that we need to expand that definition and it to a much broader category when we understand how mold can make a body sick. So we have not just the spores, but, as Michael Schrantz was talking about, one spore can break up into 300 to 500 fragments. And those fragments act kind of like asbestos. They can get into the lungs and lodge in there and cause persistent irritation and inflammation. And we can actually see lung rewiring if if we don't address that. And then there's also chemicals. So happily living mold, it's like a factory. This Brian Carr talks about this. He's another talented inspector. If mold is the factory, it metabolizes. And as it's metabolizing, happily living metabolizing mold, off gases, and I jokingly in my book call them mold farts, it just off gases these chemicals like VOCs, aldehydes, alcohols. There's a chemical they off gas when they're in a growth stage called MPA, or mycophenolic acid. It's not a mycotoxin, but it's a toxin associated with happily living growing mold. And we actually use that toxin as a medication in medicine to shut down the immune system for organ transplant. So you can understand that, medicine actually understands how dangerous these are because we use them for medicine. And then there's this other part where mold will make these toxins called mycotoxins, which are, the intention in those is a weapon. They are trying to defend their territory against other microbial things. So it could be other bacteria, other molds that want to come into its little sweet spot that it found. All mold needs is humidity. It doesn't have to be a full-on flood. And so if it found that humid, stagnant environment that has the food that they like, they may, and if other spores want to be in the same space, they may now start to spit out these mycotoxins. And these are ultra small chemicals that can make it through building material. So even if the spores are trapped underneath the flooring or behind the walls, the mycotoxins get through and the person can be having mycotoxicosis as their only mold symptom and none of the other stuff that the CDC looks at. So maybe they don't have any respiratory changes. Maybe they don't have any hay fever or sinusitis, but they still can have mold illness. And these are the people where they go to their doctor and they get a mold allergy test, that IgE test, and it looks completely normal. And they come back to me and say, well, I can't have a mold problem. My mold allergy test was negative or normal. And that's why I'm trying to expand this definition, have people be aware that in my practice, even before I was the mold lady, granted I was seeing chronic Lyme patients, but 75 to 80% of these people's symptoms were from the mycotoxins and not from spores or spore fragments. So what that means is that, so now what? What are the symptoms of when you add in mold chemicals? Well, then we see chemical sensitivity, chronic fatigue, fibromyalgia, skin rashes, and some respiratory irritation. And now let's add on mycotoxins. When we understand that these mycotoxins are fat or oil soluble, then as doctors, that's different than just like, a fat tire or booty fat and that kind of thing. That means, as doctors, we know that means brain tissue, nervous system, gut lining, the omentum, which is this, fat pad that protects our organs. That means skin. That means a whole lot. Every cell lining, mitochondrial linings. That's where all of these toxins can go and store, accumulate. And those kind of symptoms are going to be much more varied. What it does with a person is it takes whatever their Achilles heel is, whatever their tendency, and makes it worse. So there are some common ones like fatigue, some kind of gut disruption. So if they tend toward constipation, they'll be more constipated. If they tend toward diarrhea, they'll have more diarrhea. Skin problems, vision problems, because again, it likes to go to the fatty areas. So these mycotoxins also affect how we process visually. You can see urinary frequency, and some oddities that are really specific to mold is anxiousness. Almost every mold sick patient that I have worked with has had some level of anxiousness, and also ear ringing. And it makes sense because we have one of the chief drug categories that causes ear ringing is antibiotics. Well, most antibiotics are synthesized from growing fungus. So that's just kind of gives you an idea of like, okay, that's not a clean list.
It can go in every possible direction, it seems like, and like you're saying,
direction.
And like you're saying, even though so you're looking around in your house and you're not seeing anything, everything looks fine, but it can then be hidden. You have these little fragments that come through the wall, and that is what you're being impacted by.
Yeah, these little toxins, they ride dust. So I joke in my book that, people that have been made sick need to dust with gusto, because it is the dust that these toxins are riding around on in our air. And, if you walk across the floor, you're going to stir some of that up. Yeah. But you do need to take care of the source for sure. Yeah, and it's more the rule than the exception that everybody in the house will have a different picture than every other member of the house, because it does affect you uniquely, each of us based on our genetics, our nutritional status, our previous exposures to mold, maybe our other exposures to other toxins, environmental problems like heavy metals or radon or something like that. That can kind of set the stage for everyone to have their own way of displaying how that looks for them. And if anyone is listening and they're like, oh, I wonder if this is what's going on with me, I have a little quiz online. It's an educational thing. It's short. It's only 10 questions, but I have a lot of education there if you want to read more about it on moldquiz.com. And it just gives you a result of might it be mold or not. And it's just part of education.
Yeah, which is huge. We're going to take a quick break. Mm-hmm. You're listening to Health Made Radio. I'm Dr. Michael Karlfeldt. I'm here with Dr. Jill Crista, and we are talking about something that more people are suffering from than we are aware of, and that is mold and how that is impacting our health. We'll be right back. Welcome back to Health Made Radio. I'm Dr. Michael Karlfeldt. I'm here with Dr. Jill Crista. She is the author of Break the Mold, 5 Tools to Conquer Mold and Take Back Your Health. And this is a fantastic guide. It's a do-it-yourself guide, where you don't have to rely on somebody else, but you can really go into depth as to, is mold something that is impacting myself and what to do about it. That's a really powerful book. So you brought an interesting point, because a lot of people are thinking, you have one person having a certain type of symptom, and then another person is reacting another way, and so you're thinking that these are two separate type of causes, when in reality it can both be mold, or it can be all be mold. Maybe one is dealing with anger, irritability, anxiety, and someone else is dealing with fibromyalgia, another one's dealing with gut issues. And all of this can be then related to mold.
Mm-hmm. Yeah, and it will happen at different time frames as well. So I'll often hear one member of the family isn't affected at all, and they think that everybody else is just nutty, or hypochondriacal or, something like that. And they say, well, mold doesn't affect me. And I think, well, if it didn't, then militaries around the world wouldn't be using mycotoxins as biowarfare. And if it didn't, we wouldn't be using MPA as a reliable immunosuppressant drug. So it's not a factor of is it affecting you or is it not. It's just not affecting you yet to the point where your toxic load cup is filled up and it's now spilling over as symptoms.
And are some molds worse than others? I mean, is there one that you really should watch out for versus another?
I love that question so much, and I'm going to tell you why. There are all of these indoor toxic molds that are mycotoxin formers are dangerous. They can do, like ochratoxin can cause kidney cancer. Aflatoxin can cause liver cancer. The big, bad black mold, the one that people are familiar with, if they're familiar with toxic mold, that's Stachybotrys, that makes these mycotoxins called trichosacines that are potent protein synthesis inhibitors and are also carcinogenic. They can cause birth defects, infertility, all kinds of things. But if you talk to many inspectors, they will say it's one of those things where you start to be biased by your experience. They are getting called in to assess water damaged buildings. So they're only seeing the sick buildings. And they see Aspergillus and Penicillium all the time, which are ochratoxin formers. So they'll say, oh, we normally find that, so don't worry if it's at some level. And I've had more and more families where they were told that, and then we end up, with some sad stories, of birth defects or cancer causing or something like that. And they were told that, well, we see it all the time, and so it's okay. And that's another thing I really want to stop normalizing that and understand that these inspectors, they're not all created equally, and they also they need to see that they're seeing the world through their bias. Just because something is found commonly doesn't mean it's healthy. So yeah, there are ones that have can get to the job faster of affecting your health, and then some of those that are affecting your health maybe only through hormones and the immune system. And so it's not something that you're really able to pinpoint that, oh, this is a mold problem. But I can assure you that I've worked with patients exposed to the commons and the big bad uglies, and they're all sick people. So I think really respecting mold and what it can be doing to a body, I think, is just good advice.
Yeah, exactly. And I mean, you brought out another good point. I mean, we look upon, a female having, hormonal issues, maybe severe PMS, or and they get anxious before their period, or and we just think that is just strictly hormonal, but not recognizing that there's something behind that dysregulation of the hormones, and it can be something like mold that is triggering that. Right.
There's a mold that likes to live in HVAC systems, in ductwork, called Fusarium, that makes a mycotoxin called zearalenone, and that's an estrogen, a xenoestrogen, basically. So it's creating estrogen receptor binding and putting somebody into, depending on their body, again, their tendency either into estrogen dominance or into deficiency. And so, and that can actually lead to more estrogen dominance issues, or, the bad estrogen, so to speak, issues. So it's every mold is a little different. Each mycotoxin is quite diverse in what it can do to a body. So when I'm talking about them, I'm kind of lumping them all in. But all of them, the commonality among all of them is that they reduce mitochondrial function. So that's why we see fatigue as a really key part of the symptomatology with mold illness. Brain fog, basically a brain that's run out of gas.
Yeah, exactly. And like we're talking about that mold, being a recent issue. I mean, mold is an organism that is highly evolved and been around for a long time, which means that it has become very intelligent in how it's behaving within us and in the environment, and how to manipulate then our bodies in a way to benefit its own existence.
Absolutely. Yeah, that's when I give presentations to about Lyme and mold, this combination that we're seeing a lot, I say, take the 10,000-foot view. Lyme is a bacteria that needs you alive to survive, where mold would just as soon compost you. It could have more babies if it could compost you. Lyme needs to keep you alive to have its babies. So, I respect the fungus. Not that I don't have a lot of respect for Lyme disease, but my primary target when I know there's mold involved is the mold, so that we can use all the other things that help for these stealth infections to greater effect and without as many side effects.
Yeah, exactly. We're going to take a quick break. You're listening to Health Made Radio. I'm here with Dr. Jill Crista. She is the author of the book, Break the Mold, 5 Tools to Conquer Mold and Take Back Your Health. We'll be right back. Welcome back to Health Made Radio. I'm Dr. Michael Karlfeldt. I'm here with Dr. Jill Crista, and we are discussing how mold may be impacting your health and what you can do to address it. So how do people then find out? I mean, how do they kind of find out if mold is the issue? I mean, what do they do as a next step? They have all these symptoms. Maybe you have a child with ADHD or dyslexia or anger issues, and you yourself, you can't focus, you're tired, you can't sleep. How would somebody go about, in addition to then obviously the questionnaires? You have a great questionnaire in your book, on your website, but are there any kind of labs and tests and things that people can do that you would recommend?
Yeah, one of the things I like to use is a mycotoxin testing to see if the body is storing it and or upset about exposure to mycotoxins. That is one data point that I'm looking at in association with many other things. First I try to start with something their insurance will cover. There are things that we can see on really inexpensive testing, like a CBC or a complete blood count. We may see a low white blood cell count because mold is very immune suppressive. It can rewire your immune system to be more wimpy, and it will actually rewire it at the gene level if the exposure has gone on long enough. So often we can see a low white count. We might see some changes on that, on the CBC that are relative changes. So if you have historical numbers on somebody and then all of a sudden they're starting to show that they have a little eosinophilia, a little lymphopenia, some of these things that we might say, this might be a mold thing happening. And then we would look at a chemistry panel, another really standard lab, looking at the liver enzymes to see if the liver, since the liver and the kidneys are the organs that help excrete these toxins, they may start to complain. And so we might see increased liver enzymes. We might see a slowed kidney filtration. And then some things that I like to look at, and anyone listening, if you're curious, there's a test developed by Dr. Shoemaker, and I know you've talked with him about this. I am not Shoemaker trained. I'm a naturopathic doctor, so I was more Crinian trained. But I love this test for when I want to understand how deep into the nervous system has the mold gone and how much is it affecting that. So are the vision changes and the brain fog and the cognitive problems, are we talking about mold toxins that actually can get through the brain? And that's when I like to use Dr. Shoemaker's visual contrast sensitivity test. People can do this online through survivingmold.com or through vcstest.com. It's like $15, and it's a great scan to see how deeply affected your nervous system is, and then that helps your doctor determine how much neurological support that you might need. And then also from the same kind of idea, but for the immune system, is taking a look at natural killer cells. These are one of the cells in our innate immune system. Those natural killer cells start to lose their function when they've been poisoned by mold toxin. And so a natural killer cell function test, this is given in lytic units. If it's low, that tells me that their immune system is now pooped out to the point where it's probably not keeping up with the toxin load to where they might start now having fungal overgrowth to a degree that we have to be more heavy-handed with the antifungals. So that's sort of my overview. We might do a stool test if the digestion is really where they're affected, and that we can see things like candida overgrowth. And if it's something where I really don't know how deeply depleted their nutrients are, or their glutathione status or something, I could run a organic acids test. This is a urine test. So there's lots of ways to do it. If we already know it's mold, we don't do any testing typically, because they're going to need to spend that money on their home or on getting out of their lease or something like that.
So when you say without these tests, if we already know that it's mold, so you just assume with the symptoms and you've seen it in the house that it's mold, without doing any of these other tests. Yeah, because what we're doing for treatment, we're not typically having to give anything pharmaceutical. It can happen for sure, but the treatment it's gentle enough. It's a lot of things that we use all the time that we're really familiar with, but it's done in a very targeted way so that we're helping the person to detoxify the mycotoxins, protect their tissues for when you add these antifungals. One of the things we know from mold is that when you start to expose it to antifungal medications, it will start to kick up its production of mycotoxins to defend itself. Super smart. But the problem with that is that if you're targeting something in the body and the body is already very burdened by these toxins, then we need to help. The first step being slow down and get the tissues protected and get the body detoxifying, get excretion moving, get the emunctories open. This is a very naturopathic view. The emunctories are all of the pathways that we detoxify. So like our breath, through bowel movements, through urination, through sweating. If a person isn't having regular excretion, then we really need to slow down and get that system working so that we can get the body ready to get rid of this very highly toxin-based illness. Yeah, exactly. We're going to take a quick break. You're listening to Health Made Radio. I'm here with Dr. Jill Crista. She is the author of Break the Mold: 5 Tools to Conquer Mold and Take Back Your Health. I have the book right in front of me here, and it is an amazing book. And what is great about it is that it is very user-friendly. It's not intimidating in any way, so this is something that anyone can pick up and figure out how to solve the riddle of mold. We're going to take a quick break. We'll be right back. Welcome back to Health Made Radio. I'm Dr. Michael Karlfeldt. I'm here with Dr. Jill Crista, and we are talking about mold. And I want to chat a little bit about, so now we have figured out that it is mold, and what then? I mean, what do we do then? I mean, what are some of the tools, to conquer this mold?
Yeah, one of the first easy things to do is, well, I'll back up. So my teacher, Dr. Krinian, nailed it in my head that any toxin-based illness, the first 3 steps are number 1, avoidance, number 2, avoidance, number 3, avoidance. You can kind of see where we're going here. So, getting away from that exposure, this is key. Half of the people that get out of their mold exposure get better without any treatment. We see this in occupational studies. So that's the hopeful message, is that, wow, I might be on that side of that coin flip where I could just, once I've figured out it is mold and I've been able to link it to these symptoms that started after I took this job or we moved into that apartment or whatever it is, just getting away from that mold exposure. Now, that's the easiest thing to say and hardest thing to do in many cases, because it may involve having to change a job or talking to your boss about different work arrangements. It may involve remediation of their home. It may involve expense. And so that's why I'm, try to make sure that we're being very smart and judicious about how much money they're spending on testing. If we already know it's mold, then we can shift gears into, let's take care of the avoidance part. So avoidance can be intimidating, and that's often where people get stuck. And that's why it's nice to use inspectors like Michael Schrantz that you had on, that can help really navigate that, because easy thing for avoidance is also avoiding moldy food. And that would mean not just fungal things, And the reason I take people off things that are in the fungus family is that the message in those mycotoxins is fungus is coming to take over my body. Fungus wants to take over. And so if you're adding more fungus to your body burden, that can aggravate your symptoms. And I learned this the hard way. I used to put people on Saccharomyces boulardii because the studies say it was a really good binder and it kicks out candida overgrowth. And that's true in studies where they have animals on controlled diets. My patients aren't on controlled diets. So when I put them on Saccharomyces boulardii, they became sweet cravers or alcohol cravers or these kind of things. And they ended up with more fungal burden and more aggravation of neurological symptoms, immune symptoms, that kind of thing. So I take people off medicinal mushrooms, yeasts, food mushrooms, cheeses like blue cheese, fermented foods, and this is all very temporary. It's just part of that first therapeutic diet phase to try to reduce the fungal burden, but also reducing foods that are high in mycotoxins, things that are a little moister that we grow in mass and store in mass. So that's things like corn. A lot of the grains are quite moldy. Peanuts. I haven't met a non-moldy peanut yet. I test everything all the time. Whenever I get a little extra cash, I'm like, ooh, let's test a peanut. And so I'm testing food and I'm testing water and just trying to understand, what is our true mycotoxin burden. And thankfully now there are more and more tests out there, or research studies out there, that we can get better information about actual human food, not just animal feed. And so apples are also, there was a recent review article where they looked at a bunch of research studies from the U.S. and other countries for just human consumption, and apples and grapes tested quite poorly. Coffee tested quite poorly. So using a mycotoxin-clean coffee like Purity or Bulletproof, I'm trying to think of all the things. And then any animal-based product where we feed the animal those moldy foods like the corn, the soy, the peanuts, the grains, because they're fat-soluble, that can concentrate in fatty tissues that we then ingest, like eggs and dairy. So I try to encourage my patients to use cage-free eggs only and only organic dairy. So those are some ways that we can really cut down our mold and mycotoxin exposure using avoidance, not just the environment, but through food. That's a great first step.
And you, one of the vitamins or one of the supplements, I mean, you went through a lot of the supplements, which is great, like B vitamins. I mean, people think that everyone should do B vitamins, but that's also one of the ones that you recommend to stay away from, correct?
Well, or just be cautious of, to notice. So if your doctor, you go somewhere, you hear a talk like this, and you think, I'm going to get the book and I'm going to take all the stuff, do things in a stepwise fashion, because then you can identify if you're one of those people that react to things that are synthesized with fungus. And B vitamins are one of those things. Vitamin C is also, interestingly enough. Citric acid, which is a food additive, a preservative that's added to a lot of foods, juices, liquids, where they're trying to keep it preserved. Citric acid, ascorbic acid, those are synthesized with fungus. So temporarily, some people, even though they may really need the B vitamins, we will try to get that through other things like seeds and beans and things that may not be as aggravating to them as a supplement. But I'm just trying to raise awareness, just because somebody said it was a good thing to do, it may not be a good thing for you based on your exposure. And when it comes to mold, that's going to be things that are synthesized with fungus. Enzymes also, digestive enzymes, some of those are synthesized with fungus. So, just being cautious and then notice. If you have an aggravation of an old symptom, it may not be a, quote, healing reaction. A lot of stuff is getting blamed as a healing reaction. It may be that you're actually sensitive to that supplement.
Yeah, and you kind of touch on what's called the Herx reaction, where people think I'm supposed to be herxing, that means that I'm getting rid of toxins, and that's a good thing. And you said that it's not something that you really like to see much in patients. and you try to do everything you can to minimize that effect.
Absolutely. A Herx reaction, the classic Herx reaction is from someone who had Lyme spirochetes, and they were put on an antibiotic. So big bug, big drug, and you're going to get a massive die-off. And that should last 2 to 3 days if it's going to happen. And, after going through Lyme training as a naturopathic doctor, with my view, I'm thinking, well, why aren't we prepping people? If we know this is something that happens, why aren't we prepping people so that doesn't have to be such a deal? And I found the same true for mold, that if we do our homework and we get their nutritional status set and we get the right supplements in there to assist detoxification, immune modulation, like vitamin D, then people don't have to have a Herx to get better, first of all. And then we can make it a little gentler on them when we do add the antifungals or the antimicrobials.
And in your book, you go through the 5 tools, avoidance, and you have the fundamentals, and protect, repair, fight. Obviously, this interview will not be able to cover all of that. That's why it's very important that people get your book. So what would be, I know fundamentals, obviously, avoidance, fundamentals, and you probably pretty much took them in the order of importance, and people feel that probably fight is the most important, but the other, if you don't do the initial steps, to get to fight, you won't really be as effective, and it can be more detrimental for the individual. So what are kind of some of the key components that an individual need to do in order to prepare themselves, for that fight?
Sure, that's a great question, and I'm so glad that you asked about the order. The best picture in my head that I could come up with for how to depict this graphically is an orange, because the first 2 steps really need to be done almost 100% in order to get better. And for some people, once they do step 1 and step 2, they're better. They don't even have to go any farther. So that's why I was trying to think, okay, what is it? It's not really peeling an onion. It's not, because the first 2 need to be done 100%, but then the next ones can be picked and choosed and kind of picked at, sectioned. And so I came up with an orange. So the outer layer, that orangey layer, and then there's the white fluffy layer. I think of those as the first 2 that, we wouldn't eat an orange if we left those on. So that's avoidance, and that's fundamentals. And so I talked about avoidance. Some of the key things in fundamentals are getting on a good circadian rhythm, getting to bed. People have kind of a sleep bravado. I think that's changing a little, and that's really fun to see, because I spent so much time in practice trying to convince people that they do actually need to go to bed. Eating vegetables, some of those things like that your grandmother probably is telling you about. And then getting in the fundamentals, that's where we talk about emunctories, getting all of the ways that the body excretes waste. Every kind of waste needs a different route out. Some are gaseous, and so we have breath. Some are oily, and so we can get it out through sweat. Some need to be packaged in bile, and that's what a lot of mycotoxins are, packaged in bile, and that needs to be pooped out. So, each toxin has its route that can get out easier. And then we get into the protect, meaning that we want to get the body ready for any of these mycotoxins, not only protecting from their existing exposure, but also get it ready for the fact that when we add antifungals and try to reset the body's microbiome, you're going to have some increase of that toxin. And so protect things are like binders. You hear a lot about binders. I'm sure Dr. Nathan talked about a lot about that, and Dr. Shoemaker. What's brilliant about cholestyramine or Welchol is that the intention there is to pick up bile. We are really, really efficient bile recyclers, which is wonderful when you're trying to preserve fat-soluble vitamins through the winter. Let's say it's, you get your vitamin D in the summer, and then it's wintertime and you don't have as much sun exposure. That's where it's really nice to recycle bile efficiently, because you can hang on to those necessary nutrients. But it doesn't work really well in an environment where you have a fat-soluble toxin. Because now what we're doing is recycling that toxin, and the liver has to process it over and over and over again, and it damages the liver over time. It depletes its nutrients. So I use things because I'm a naturopathic doctor, I like to use things that bind bile that also contribute nutritionally to the body, and that's insoluble fiber. So things like good old psyllium husk, flaxseed, chia seed, rice bran fiber, oat bran fiber, those are all things that can grab bile and carry it out in the poop instead of having us recycle it and carry these toxins back to the liver. Turns out that steamed kale makes a very effective binder as well. It's about 40% the strength of cholestyramine, but it's a provider of natural vitamin C and natural vitamin A and the fiber that we're looking for. And that wasn't in a mold study. That was in a study where they were looking at people who had had their gallbladder taken out and were having problems with bile creating some loose stool. And they were looking for what was it that they could give them that would be effective in mopping that up. And they found insoluble fiber and steamed kale to be very effective. I think that's so cool. Then you don't need a pharmaceutical that's going to deplete your nutrients over time.
That's fascinating. And one, before we finish, what would be one of your most favorite mold fighter? I mean, I know that kind of comes towards the end, but which one is it that you kind of are drawn towards more often than not?
Well, I'm drawn toward it because it's so safe and it's so effective, and that is thyme, the herb thyme. You can use thyme in a bath if you have a baby who's sick from mold and you want to increase their antifungals and you don't want to be putting anything in their mouth. That can be something you can actually dip baby in a thyme tea bath. So it's safe enough even to do that. You can do it as a gargle. You can take it as tea. You can take it in capsules. You can take it in tincture. And it is safe up to 2 times the concentration that it takes to kill the mold. You can take it up to those kind of concentrations over long term, and it's not going to negatively affect the body, the detoxification or the microbial balance. So it's a very, very safe plant. This was used in essential oil form in hospitals before we had antiseptics. As an antiseptic, they would use thyme essential oil, or they would boil thyme in the room to kill off the fungus, but also bacteria. So we see a lot of people that are exposed to a water-damaged building are exposed to bacteria in that building as well, and I write about that in my book, that in some cases the endotoxin load from the bacteria was much higher than the mycotoxin load. So whenever you have a water-damaged building, you're going to have mixed microbial diversity, and thyme is very effective against the bacteria that we see that people get in their nose called marcons. So it's just a wonderful, across-the-board, broad-spectrum antimicrobial that is very effective against the critters and very gentle on the person.
Wonderful. Well, you brought a wealth of information. I'm so grateful that there are people like you that are bringing this type of information to the forefront. Thank you so much, Dr. Crista, for chatting with me today.
Thank you so much for the invitation. I really appreciate it.
Thank you. That is it for today. You're listening to Health Made Radio. Remember, check us out at healthmade.co. Health is what you make it. 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 Health is what you